Hello out there in television land. It's your health, Philip Benyo, with the Fipster Philip Benyo. We're here to talk about new drugs and new topics in medicine. I know it's been a while, so get your TiVos ready so you can keep an eye on us. Remember, you're watching It's Your Health. We'll be back after this brief commercial message. Remember, you're watching It's Your Health. It's your leader in healthcare information, right, Phil?
I guess so, that's right.
Be right back. Welcome back to the first segment of It's Your Health. And it's been a while since we did a show. I don't know where the summer went. Of course, we went through summer and we're through football season. And happy holidays, everyone.
Happy holidays. Let's get back to some headlines.
Okay, we have a lot to go over. Okay.
Hepatitis B vaccine is advised in diabetes.
It's kind of interesting. And the reason why is because if you have your own glucose monitor and you're using it, it's not an issue in terms of blood transference. But if you're lending out your meter or someone else is using it and there's a sharing of the meter, there can be a concern for the transmission of hepatitis B. And so that's very interesting. I think if you're at all concerned, you should check what your hepatitis profile is. We can measure that in the blood. And if need be, get vaccinated. Why worry about it?
There's a lot of different ways you can get hepatitis B and hepatitis C for that matter, but at least hepatitis B is something we can prevent. You know, people who are testing their blood sugar, they'll sometimes tell me, well, how often do you change your Lancet device? They say, well, they stop when they doesn't poke them anymore. I'm like, well, that's not good. You're supposed to change it every time, but you don't know what's happening out there. Right. So you have to fend for yourself. Moving on. Another win for coffee. Coffee fights skin cancer.
Yeah, coffee, of course, used to be in the doghouse for a while, but it's now come out as being a super drug, if you will. It does fight a lot of things, and now skin cancer. How much coffee, Phip, do you have to drink before you get the benefits of preventing skin cancer? They
looked at 1 coffee per month versus more than 3 cups a day, and for women, there's a 20% risk reduction in basal cell cancer, which is a common type of skin cancer. For men, about a 9% reduction. But 3 cups a day, a little steep.
Yeah, well, you probably don't get sleep, and so you're not going out in the sun as much, perhaps.
I think that may be more part of it. Moving on. Analgesic use in the risk for renal cell carcinoma.
Yeah, you know, when you look at the population, I think there's like 60 million of us out there in television land who are on what are called non-NSAIDs. These are non-steroidal anti-inflammatory drugs, Nuprin, Advil, Motrin, if you will. And people take these things all the time and they think they're like candy. They have liver toxicities, and now it's proposed perhaps there's an increased risk of renal cell cancer with these medicines because, of course, they're cleared by the kidney. I would not push these drugs too much. They're not candy. They can elevate your blood pressure. They obviously have some cardiovascular risks as well.
As a result of the Vioxx debacle, we now know that NSAIDs increase your risk of stroke and heart attack when taken more than, say, 40 times a year. So these definitely are, although it's over-the-counter use, they shouldn't be used over-the-counter, you know, just carte blanche.
Exactly.
You really need to let your healthcare provider know about this.
Yeah, they are drugs.
Well, it's that time of year again. It's hard to imagine. It's depressing to talk about. But here we are in flu season.
Yes. We've, of course, been giving out flu shots. Still not too late to get your flu shot. Flu, of course, is going to start seeing us after the holidays because people from all parts of the country who come in and mix and greet one another will spread a virus. Plus, we go from outdoor sports such as soccer and football to indoor sports. So people are more confined. But getting back to your question, can we go over some of the symptoms of the flu?
Yeah, it's important, I think, to know a lot of people think if they just get a cold anytime from November on, it's the flu. And, they'll have some people already have told us, oh, I've had the flu twice this year. I'm like, well, that's pretty impossible. There's really no reports of the flu yet here. We don't usually see it January, February, March. Right. So if you look up on the screen, here's a shot we've used before that shows the real key differences between whether you have the flu or whether you have a common cold.
Right. Sudden onset with the flu. That unmistakable feeling of getting hit by a Mack truck. It has to be a Mack truck, by the way. Headache.
American made.
That's right. Headache, sore throat, dry cough.
Muscle aches and pains.
Muscle aches and pains. And if you are not into the flu shot, what you might consider doing is getting Tamiflu and getting that in your drug cabinet before the flu. I can recall I drove home here once a Thursday night, come down with the flu, shaking chills. I felt like I got hit by the Mack truck, fever. I didn't want to move. And I started on Tamiflu within the hour. And as crazy as it sounds, I was at work the next day. It completely aborted it. You have to take it immediately, Tamiflu.
It's neat stuff. It's certainly it's excellent stuff when you take it on time. Moving on, let's go ahead and talk about some of the new drugs that are out there. There's all kinds of new things happening.
Yes. Where are we starting?
Well, the FDA recently approved a drug called Juvasync, which is a combination drug of Januvia and simvastatin. Kind of a make-sense combination. It's a diabetes medication that we use a lot. It's been a pretty safe medication. It's been worked. We use quite a bit of it in our practice, and certainly simvastatin or Zocor is something we use a lot of as well. And it's a way to cut the pill burden, take 2 pills that you're going to be on and make it into one.
Right. All diabetics, of course, should be on a statin to lower their cholesterol, if you will, because of the cardiovascular and other vascular risks. So if you're going to be on a statin, instead of taking 2 pills, maybe you can take one, which already has your statin built in it.
The FDA recently approved a drug for COPD called Dalresp. This is actually a little bit different. Some of the recent COPD medications we've talked about are all inhalers or puffers of some sort. This is an actual pill that's used for people who have had, chronic to or moderate to severe COPD. They have chronic bronchitis. They've had some flares. The medication, it really can help lower our hospitalization rates. It's a simple pill. The side effects are pretty limited. Safe with a lot of different medications. Certainly worth talking about if you're already on a couple of inhalers and we're just not under good control. It's one of the ways to go.
Yeah, look forward to using that one.
Did we finish up a segment already?
It's hard to believe. Maybe we should go on to the next segment.
I guess so.
Well, actually, you're watching It's Your Health, your leader in healthcare information. We're going to be right back after this brief commercial message. Stay with us. Welcome back to the second segment of It's Your Health. And before we start, Phil, I have to thank our viewers out there in television land. We can't really go anywhere around the town without people pulling us aside, telling us how much they enjoy what we do. We, of course, don't make it an infomercial about ourselves or our practice. We just are out there in the public interest, giving medical information. It's up to date and reliable and true. But thank you so much for your kind help. I enjoy shopping and being asked about your hemorrhoids while I'm picking out.
Or your toe fungus. That's also a great. When I'm looking at my steak for the day, the week, or my ham. But it's always been. It's always nice. It's always enjoyable, and it's nice to know we're helping people. Not necessarily here in the office, but kind of all over.
No doubt. So appreciate it.
Let's move on to some more headlines.
Let's do it.
Macular degeneration drug Eylea is recently approved.
I'm not an ophthalmologist. I don't pretend to be one. Maybe you can tell us a little bit about it.
Well, age-related macular degeneration is one of the leading causes of blindness in the United States, and there has not been much in the way of medications to help reverse this. This is one of the medications that actually helps cut down on some of the overgrowth of the blood vessels in the eye that do create this type of degeneration. So there is something out there. We have a lot of patients who come to us and say, what is there? And so the only thing we ever offer is Omega Eye, which certainly can help, but this is another way that we can help as well.
Yeah, check with your eye doctor, because of course that's a very disabling disease. But you mentioned the fish oils, Phil, and the more we are into fish oils, it's just impressive seeing the testimonials that we get from our patients. They just get them on their own. It is a tremendous anti-inflammatory for various illnesses. I myself take it, and how much wood do I split and cut?
It seems more and more every day, despite the pile not getting less and less.
And I don't feel anything from it, believe it or not, thank God. But I really attribute it to the fish oils, because when I don't take them, I do feel my age, if you will. So powerful anti-inflammatories. They are pharmaceutically graded and distilled. Look into that if you want to cut down on your aches and pains.
Neat stuff. Moving on. Another win for coffee. Coffee may cut the risk of endometrial cancer.
Now, is that right? Is this in men or just
your
women?
headline?
Okay. Tell us about this, Phil, if you don't mind.
Well, they show that by increasing your coffee use, and again, I'm not sure about the number on this, but for some women, it can reduce the risk of endometrial cancer up to 30%.
Wow, that is just amazing. And keep in mind there is some caffeine in chocolate, and of course, chocolate is always good, particularly this time of season.
Lastly, blood pressure drugs at bedtime may cut heart risk.
Yeah, that's kind of interesting. Most people are taking all their medications in the morning, and we find people who get tired and weak because these medicines hit them all at once. And keep in mind out there that after you eat a meal, such as breakfast or any meal for that matter, the blood flow goes to your belly to digest the food. So guess what happens? Your blood pressure falls. So not only does your blood pressure fall after each meal, you take 2 or 3 blood pressure pills at that meal, and guess what? You may feel tired and weak and lightheaded and dizzy throughout the day. But the take-home message here, I think, is that there is a nocturnal, while we sleep, around 2, 3, 4 o'clock in the morning, a boost of cortisone in our body. It sort of is our way of waking us up. And with that comes adrenaline, which can elevate your pulse and your blood pressure. And that's why when you worked in an emergency room, you'll notice that, geez, strokes and heart attacks are coming in at 6 o'clock in the morning. And that's because of that surge of wake-up type of chemicals in our bodies. So perhaps taking your blood pressure pill at night will help to stave that off.
It's certainly worth talking to your healthcare provider about, because certain medications definitely work better taken in the morning, and you don't want to switch them all to a different time, because then sometimes it could drop you a little too low at night.
Right.
So for people who are on multiple medications, it does help to split them.
No doubt.
Moving on, I think this is something that's rather interesting, is they found a recent cancer drug called Rituxan is able to help people with chronic fatigue syndrome, fibromyalgia type issues.
It's an epidemic, of course, in our area, chronic fatigue, fibromyalgia syndrome. We feel strongly that there's an inflammatory condition going on here. Again, that's a use for fish oils. We've seen a lot of luck. So if we could find an anti-inflammatory drug, we're going to see improvement in clinical symptoms. And this is what this particular drug does?
Well, it's a type of chemotherapy that's used for certain types of like CLL, chronic lymphocytic leukemia, and those type of blood dyscrasias or blood disorders. And it's actually a rather well-tolerated medication. We don't run into too much trouble with that, at least the patients we've seen that are on it. It's pretty decent stuff. Be worth looking into.
It would be worth looking into, because it's very frustrating when we're treating symptoms of chronic fatigue, because that's all we can do. And here's a drug that might be able to attack the core inflammatory response, which is responsible for these symptoms.
Moving on. Let's talk about some of the recent drug shortages we've had. I know in our office we've been plagued by an inability to get simple things like B12. The hospital's been plagued by an inability to get certain antibiotics and things like that.
It is unbelievable. Here in this country, we're told at some point, was there at least 70 drugs that were unable to be obtained because of shortages. B12 was one of them, certain antibiotics. And I'm not sure why this is happening. Any insight into this?
Well, part of the problem is a lot of these are generic drugs that are they're cheap to make, but when they have there's not a very good profit in them. And, we live in a capitalist society, so if there's not a good profit in something, a company may not make it. And There's been shortages that are related to the FDA realizing there's a problem in the manufacturing process, and the drug company says, well, I'm just not going to make it anymore. And it's their choice to do that, but we're left to suffer.
Right. I had a patient, believe it or not, who had to get their Dilantin from Mexico or something because they didn't have it around here. So it's frustrating, that type of shortage. But there's no shortage of good medical advice here on It's Your Health. Are we done with the segment yet?
Yes, we're done with this segment.
I'm telling you.
We're not done with it. That's the problem.
It's the fastest half hour in television history, there's no doubt. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the final and fastest segment of
This one's going to be quick.
It's Your Health.
It's the last one.
There must be some kind of time thing here.
It's odd. They should study it.
Okay.
Top men.
Speaking of studying, what are we studying today, Phil?
Well, going back to some headlines, the FDA recently approved generic Zyprexa for the use in a variety of disorders to include schizophrenia and bipolar disorder.
Yeah, I don't prescribe a lot of that. People on Zyprexa for schizophrenia, mood disorders. Has the risk, of course, of maybe weight gain and diabetes, if I recall. What did this particular headline entail?
It's just generic now. It's going to be a lot cheaper.
All right, well, we're all for that.
Moving on.
See how simple it is?
Yeah, it doesn't have to be. It's pretty easy. This is an interesting one. Energy drinks have sent thousands of people to the ER each and every year. This is an increasing problem. People with the Red Bull, with diffused energy drinks. Have you had any experience or seen anything?
Yes and no. It's pretty interesting, of course. We're in a society where you're up late, we're not getting our proper sleep, and all of a sudden you wake up and you want to be back and buzzed, if you will, whereas a cup of coffee is just not doing it. And these energy drinks have additives in them, some adrenaline-like compounds, and let's just face it, we're not built for this kind of upper and downer stuff. So you can have a side effect from these things because they are rather strong and can give rise to increased pulse, blood pressure. I'm not a fan of them, but
no. And some of the dangerous things is the way people are combining these. They're using them with alcohol, so we're taking a significant downer that usually has a way of telling you need to stop drinking when you get really sick. But the energy drink keeps you up so you can keep on drinking. And so, every time I cringe, I hear someone ordering a Red Bull and vodka. That's not a good idea. It's dangerous stuff. And that's one of the problems we're running into is a lot more alcohol toxicity related with the combination of these things.
Don't combine them then.
Moving on, let's talk about some little bit more controversy. There's been some reports just recently from one of the cancer preventative task forces that we should not be using the PSA as a diagnostic tool to screen for prostate cancer in men who are asymptomatic, meaning they have no symptoms of prostate cancer. What do you think about this?
Well, I'm old school, and the PSA, by the way, is not a diagnostic test. The diagnostic test, of course, would be a biopsy. And prostate cancer is extremely common, and we're seeing it in younger individuals. It's a screening test, and that's all it is a screening test. And you should always consider getting a digital rectal exam with that, because no matter what the PSA is, if I find a lump on your prostate, you're going to go get that biopsied. So I think it's one of those things, kind of like mammograms, if you will. It's a screening test. It's not a diagnostic test. It's something that we can do to put you at either a lower or higher risk when we combine it with symptoms and an exam. So until someone tells me not to do it, I'm still kind of leaning towards let's do it.
Yeah, it was just a few short months ago we were talking about how we were going to start screening earlier at the age of 40 from a different task force, and so now they're kind of changing their minds. And I think one of the keys is they say in asymptomatic patients, and I'd argue is what's the symptoms of prostate cancer? You usually don't have symptoms until it's spread, and by then it's too late to really do anything. Then you're in trouble. So I think it's still a very important screening tool, and it's combined with exam and family history. Go from there.
Yeah, and guys out there in television land, you really ought to come in and say, I'm here for my annual, and include that, because unfortunately we do run into resistance because, for whatever reason, guys don't
like having fingers stuck up their rear.
Yes, exactly.
Well, there you have it. Here we are in the holiday seasons. We're finishing up Thanksgiving. We're going into Christmas. Reminds me of one particular pastime, and that is overeating.
Hey, food is love, and what can I tell you? It's very difficult, especially in the winter season where you can't exercise, or exercise as well, go for walks and the like. So you combine a lack of activity with high calories, and you got another 5 or 10 pounds adding on to a New Year's resolution. Any thoughts, any ideas, any
I think
plans?
it's important to recognize that it's a problem, and I think if you can identify the problem, you can try to identify solutions before it becomes a problem. And the important is to kind of watch what you're putting in your mouth. I think any one meal is not going to get you in trouble, but a week of bad meals will. Recognize that we don't exercise as much, and find a way to do that in your home. There's plenty of things you can do just in and around your home, or you can step it up and go to a gym. There's plenty of things you can do to lose weight. You have to want to. And I think that's one of the biggest things.
Well, you're sitting example of this. You've lost a tremendous amount of weight over the past months to years, and it was because of watching caloric intake and coupling that with an exercise program.
Yeah,
so it can be done. As my mother used to say, a moment on the lips means 6 months on the hips.
Let's talk about something else. We always talk about pills and side effects and all the new pills, but sometimes we often overlook the possibility that the pills could be getting us in trouble.
It's unbelievable. We see people who have chronic headaches, for example, and these people with headaches are taking Tylenol or Nuprin or Advil, and they're taking them on a regular daily basis, more than half of a month of time. Mm-hmm. And there's a syndrome called medication overuse syndrome, and it causes a headache. Yeah. So believe it or not, by taking something...
The headache pills gives you headaches, and that's even the prescription stuff for headaches. Look, the Firanols and Firacets that you see people on, these are very dangerous drugs. They actually make your headaches worse, and in a way get you addicted to these medications.
Yeah, so if you have a chronic headache and you're frustrated with it, we like to brown bag it. That is to say, put all your pills in a brown bag, bring them down, and let us give you less, because less can sometimes be more.
Well, let's talk about one last new drug, or at least maybe squeeze in one or two. There's a recent new medication that came out on the market called Tradjenta. This is one of the DPP4 inhibitors. This is a medication that works very similarly to Januvia and might have some better data for lowering sugar. Have you had any experience with it yet?
Not yet, but have you?
We've used it in a couple of patients, and I think some of the advantage to this medications is we don't have to keep an eye on the kidneys as much as with its counterpart. There's no renal or liver dosing.
Right.
Whereas its counterpart, there was some recent label changes that make us be mindful of that.
Yeah, in patients you started it on, we've seen in follow-up sugar results excellent.
Yeah, it's a great way to stay off insulin, but it's certainly one of the nice regimens that we have now for diabetes. And that's something we'll talk about on the next show. I have a couple new medications that are going to be coming out in the next year or two that are very exciting drugs about in the diabetes market.
Right.
But we just ran out of time.
And of course, diabetes is an epidemic, especially after this holiday season. But thank you so much for allowing us to come into your home and hopefully inform and entertain you. Philip Benyo with the Pipster Philip Benyo. You remember, you're watching It's Your Health, your leader in healthcare information. Happy holidays, and I hope next year is better than this year.